Hi, this is Dr. Michael Ryan with Missouri Vein Care answering a question. What is chronic venous insufficiency? Well, it's a strange phrase, a few words in there that most people don't understand, and actually a lot of doctors don't understand really what it means either. The word insufficiency is a word that's used to describe a part of the body that isn't working normally. It's insufficient in its function. In the case of varicose veins and vein circulation, the vein valves inside the veins in your legs are failing. They're not working normally. When those vein valves fail or become insufficient, the blood doesn't flow properly and the circulation slows down. Pressure builds up in your legs because the blood is pooling down in your legs rather than circulating back to your heart. That causes not only direct pressure on your legs from the extra blood volume, but also it triggers a physical reaction in your tissues, and it's an inflammation reaction. When the blood's not flowing properly, the body reacts with a triggering of inflammation. Inflammation is good to help heal sores or cuts, or if you break a bone, it's part of the healing process, recovering from surgery, fighting infection. That's all what good uses to the inflammation process. But when inflammation is there every single day without a real necessary endpoint, it's not doing you any good. It's doing you harm, and the harm is very small and incremental. It builds up slowly, but it's a daily burden on your body. So the result of not having the vein valves work is that your body begins to build up inflammation, and it builds up as the day goes on, which is a very uh, typical pattern that we see is that the symptoms progressively get worse as the day goes on. So by the evening, people usually have their worst symptoms, and often the symptoms persist into the evening at night when people are trying to sleep. That's because the inflammation is still circulating that's built up during the day. And finally, for most people, it does clear out and is reduced overnight when you're able to finally get some rest. And at least if you're able to get your body flat, in the flat position is going to take the pressure off your legs and stop that inflammation from being generated. So chronic venous insufficiency is also a term that's interchanged with chronic venous reflux. And people ask, reflux, that doesn't make any sense because most people think reflux is related to acid reflux in their stomach. But reflux is another medical term which has a general application, and the reflux really means any process in the body that's going in the wrong direction that it's intended to go is associated with reflux. So you can have acid reflux where the acid goes up your from your stomach up into your esophagus and sometimes all the way up your into your windpipe for some people with severe reflux in that location. It can be in your veins, as I described. It can be in actually the bladder has reflux into the ureter. That's the little tube that brings urine from your kidney to your bladder. Reflux there can be very devastating to function for the kidney system. It can be in the heart valves. The blood flow is going in the wrong direction. The valves are not working, and when the heart pumps, the blood, instead of going in the correct direction, goes in the opposite direction that it's supposed to, and that's also reflux. So all of those are examples of reflux. In this case, vein reflux is in the vein valves, primarily in the legs. It could be the superficial veins right under the surface, or in the deep veins, which are further down next to the muscles and bones. And both of those can cause a lot of symptoms. The good news is that for most people, treatments can really improve how they're feeling and also improve their energy, because one of the very typical side effects of this buildup of inflammation is fatigue. Inflammation is like a poison throughout your body to the energy centers, this small mitochondria, which are small little components of each cell that generate the energy. And the inflammation molecules that are circulating in your body really detract from that. The good news is after treatment, energy level comes up for most people, and their leg symptoms improve dramatically or resolve. And for people that we see quite frequently that have gotten to the point where they're not moving very much or exercising, they've gained weight, they're able to start losing weight again and become active. And that's a very healthy thing. So Mike Orion answering the question, what is chronic venous insufficiency?